I am Jaron Stout.
My name is Dr. Jerrica Dodd.
My name is Jean Abdu, and I'm a consultant pharmacist in New Jersey.
I am a consultant pharmacist in Utah.
And I've been a pharmacist for 21 years now.
I think, helping patients and having that, being able to change their lives and make a difference for them really inspired me in that whole aspect of a career.
My journey into consultant pharmacy started with more of a personal story. My father was diagnosed with stage 4 lymphoma.
And at the moment, I'm going through chemotherapy again, a second time. First time was in 2015, and I'm going through it now for the second time.
And I remember being in the office with him, and he didn't know what to do. He wasn't sure what to say. It was like a total shock to him. 5 short months later, my mother was rushed to the hospital with chest pain and had to undergo triple bypass heart surgery.
When I had my surgery, that was one of something that I never would wish anybody to go through.
And when she came out of that surgery, it was almost like she came out with an Alzheimer's dementia that she didn't go in with. What I knew was that she was very frightened during that time, and she needed to have someone that she could rely on, a trusted face, and also someone that would advocate with regard to her medications with her healthcare practitioners.
And then as I got a little older, I started to realize the paradox of medicine, that the same drugs that keep us alive are the same drugs that can kill us. And I started to realize how much goes into making sure medications are used appropriately and that they're safe and effective. And so that kind of generated more interest in me in the world of pharmacy.
So behind the scenes, they don't really know that we're looking to make sure that they have the right labs, they have the right monitoring, or you see something in the chart that someone missed and no one signed, and you'll go to the unit manager and you'll say, hey, no one looked at this lab, and this value is pretty high.
There was a woman hospitalized for new onset of seizures. She also had Parkinson's disease and dementia. And so she had several problems. Not only was she having seizures, but she was totally lost. Like the doctors actually told her family that her dementia was so far gone that they were never going to get her back. And I was able to narrow down that her seizures were pharmacologically caused.
Every single medication has a guideline associated with its use, right? So if I allow a pharmacist to take that monthly review from me, now I can focus on other issues that didn't get addressed. And the facility gets their needs met, the patient gets their needs met for the first time in history.
These pharmacists are well trained and better trained than us in a lot of cases to do these things. It actually gives me peace of mind to let the pharmacist manage a lot of these things so I can focus on things that the pharmacists aren't trained in.
We receive doctorate level training on how to evaluate and treat patients pharmacologically, and also how to deprescribe to get rid of meds that are unnecessary.
We're being asked by the country to step up our game, to take care of more and more ill, very complicated people.
There's more medicine here to take care of than we as healthcare providers, pharmacists, physicians, nurses can do.
Pharmacy can take care of their specialty with their expertise, right? That's the way to improve medicine. Use people at the highest level of their expertise.
When I met the family about it, they had reservations because after she was admitted here, she had more seizures and they sent her back to the hospital. When she went there, a neurologist had started her on another medication to stop the seizures. I was able to sit down and send a phone call to that neurologist and discuss with him my findings and say, hey, you started a new med, but I'm thinking maybe we should try getting rid of these meds first and see if that solves the problem and reduce 1 or 2 other meds. And so there were several factors contributing, but I was able to kind of identify all of them and discuss it and have it resolved. And she actually left in perfect health. She did return, even though they said she wouldn't.
No one knows that you had that little interaction or that you made that discovery, but it impacts the patient because it prevented a serious adverse event from occurring.
And I knew then that I was going to develop a company that would help patients, that would fill the gap that sometimes exists between patients and their physicians, and that would also give pharmacists a chance to serve patients the way that they like to serve them most.
When you have a pharmacist that takes a time with the patient to go through their medications in detail, that provides that patient huge reassurance that someone is looking out, that things are happening, that someone's communicating. And so when you have a pharmacist connecting the dots between what they were on before, what they're on now, and what they need to be on after, and can cross-check that and actually perform an effective medical reconciliation and have an interaction with the patient, it provides the patient with, a lot of reassurance that we're watching out for their best interest, and let alone reducing complication risk and improving their outcomes. I mean, that's huge for patients.
The way I see it, in the next 5 years, implementing a pharmacist into the healthcare team will improve patient understanding. It will increase compliance to their medications, and will decrease hospitalizations.
That's the name of the game now. Everybody has to have a consultant pharmacist.
Anytime you add a specialist to the team, you're adding value. When you have a physician assess a patient, they start with the condition and move down to the meds. And that covers one aspect and one perspective of medicine. A pharmacist will start with the meds and work their way up. So it's just a different perspective of the same concerns and problems, but you're hitting all the perspectives that should be evaluated.
So to be a consultant pharmacist, I feel that you are an advocate for the patient. And it's very important because there are so many people that have questions that never get verbalized, never get asked because they don't know how to ask them. They're unsure. They don't want to bother the doctor.
But having a personal pharmacist, she knows me and she knows my situation. She doesn't know my medical situations. She knows what I'm contending with. And it's a one-on-one relationship, basically, is what it is.
It's one thing when you're looking at a name in a chart. It's different when you have that personal relationship, that face-to-face relationship, when you're talking to someone and they're actually able to look at you and say, you've changed my life. I'm more compliant. My diabetes is better managed. My cholesterol is better managed, and it's because of you.
There are patients that are waiting that can use the assistance of a professional to walk through their healthcare journey with them, that can walk through the journey of figuring out what meds, what supplements, what foods even work the best with those meds and supplements. A pharmacist can do that. There are so many things that a pharmacist can do that most patients have no idea that they could have that level of support from the pharmacist.